Welcome to episode 30 of the Yoga Meets Movement Science podcast. Our topic of focus for today's conversation is the excellent topic of yoga and low back pain. And it's it's really kind of a nuanced and a broad topic, but what we're planning to focus on today is does a yoga practice have the potential to help with something like chronic or persistent low back pain? So that's one question. And then another question is, are yoga for low back pain classes evidence-based? And again, these are kind of big and rich topics, and they really involve, like, in order to have a meaningful discussion about these big questions, this involves having an understanding, or at least a understanding of some foundations of the nature of pain and how pain works. And then on top of that, the connection between pain and things like exercise and movement, and whether or not and how exercise might have a connection with or might help something like a chronic pain condition. So there are questions like that. And then also just taking a look at if and when exercise potentially could help with pain. Does it help with pain, or is it more likely to help with pain in kind of like a general, bigger picture sense? Or are its effects on painful conditions more specific? Like, this specific exercise helped this specific pain for this specific reason. So, as you might be able to ascertain, these are like some big and weighty questions, and then applying all of that to yoga. So, for myself, I know that I've kind of grappled with and thought about these questions for a long time, and Travis and I have had discussions about this as well. Just kind of taking a closer look at the idea of yoga for low back pain and what this connection might be. Now, in order to kind of have a more meaningful and even more informed discussion about this topic, we have decided to ask a very special guest to talk with us about this today. And just to provide a little backstory on who this guest is and why he's here with us, originally, my idea was to reach out to him to write an article for my blog. And because he's kind of, I feel, well known as like a writer and an authority on pain science and the science of pain. And so that's kind of why my thought originally went to asking him to write an article. And it was a really big deal to me when he said yes. And so he has put that together for us. And this article is live on my blog, and we'll of course put links to the article in the show notes. And there's also a version of the article over on his own website as well, and we will have a link to that in the show notes as well. So he had already written this article, and Travis and I thought it was super interesting, and we also felt like it was worthy of kind of pulling out and making a broader discussion, and maybe giving the opportunity to ask him questions and go a little deeper in our podcast episode. So that's why we've invited him on the podcast. And I will now let you know who this mystery, very special guest is.
Yeah, who
His name
is this guy?
I don't even know. Who is this mystery guest? His name is Paul Ingraham, and he is someone who yogis really should know about. And we are really happy, if you're not familiar with Paul and his work, Travis and I are really happy to have the opportunity to introduce him to you here, both in the podcast and in the article. But Paul he runs and owns the website, which I would say is a legendary website at this point, that's called painscience.com. I really think of it as legendary. I think Travis does as well. So painscience.com, it's such a great domain name, and it is just full of so much science-based information about pain, really delivered in a really user-friendly, in a way that's in these terms that just about anyone could understand. So it's such a helpful resource. In addition to that, Paul was a registered massage therapist from the year 2000 to 2010. He was also an assistant editor of sciencebasedmedicine.org, and that was from 2009 to 2016. And now, just full time, he runs painscience.com, in which he just educates anyone and everyone who's interested in learning about pain science. So we're just thrilled to have Paul here with us today. Welcome to our podcast.
Thank you, Jenny. Glad to be here.
So I can kick off our first question for you, Paul. And
Sure.
that question is just trying to differentiate between acute and chronic pain, and maybe chronic or persistent pain, whether you kind of conflate those two things or whether they're a little bit different. But just to be clear that our plan today is to talk more about chronic low back pain and then yoga's effectiveness for it. But yeah, so first question, just how do you differentiate between acute and chronic or persistent pain?
There's some real challenges distinguishing between chronic and persistent, by the way. That's one way of distinguishing between pain that's kind of gone haywire, sort of dysfunctional pain. It's carrying on because of its sort of glitchy nature, versus pain that is carrying on because there's still a painful problem, because there's just still something wrong. The persistent signaling of from the tissue that's one way to make that distinction, to talk about chronic pain versus persistent pain. Are we talking about pain that's going on because there's still something wrong, or are we talking about pain that's going on because the pain system itself has gotten a little weird? Which is, both of these are definitely a thing, and it can be really problematic trying to distinguish between them. Oh, and I think you asked me about what makes chronic pain chronic as opposed to acute. Mostly just time. There's no hard line. There's a tendency in the industry to talk about pain becoming chronic somewhere around the 3-month mark. It keeps nagging you past that. But yeah, I don't take that distinction very seriously. Just if it's been a while, it's chronic.
There's even the intermediate subacute, right? Which I think in the literature is usually at like a 1-month mark. But that's helpful when you're trying to do a meta-analysis or clinical practice guidelines to, okay, well, we have to pick a point and draw a line in the sand. But as far as like, well, you've had it for 89 days and that's just acute. And now on the 90th day, now you're into the chronic pain.
Totally.
Yeah, no, it doesn't matter. The distinction doesn't matter for normal people talking about it most of the time. Even professionals and clinicians, we don't need to worry about. Subacute is just the word for the gray zone between acute and chronic.
That makes a lot of sense. I think the reason we wanted to ask you to clarify that is just, I think in many people's minds, like acute pain, which is like that shorter term pain, is more associated with like an acute injury, like you sprained your ankle and you have pain associated with that. Whereas the longer term pain that's just kicking around for a longer, like you said, maybe 3 months or more, whatever that arbitrary distinction is. But I guess it's all still pain, but it's just like, are we talking about pain associated with a super recent injury that probably is most like what's mostly contributing to that is like biomechanics or tissue damage, things like that, versus like as it becomes more of a longer lasting pain, it's maybe we have more integrated in there from like the psychosocial realms as well. So then what's like influencing that pain maybe shifting, and kind of just asking about that distinction, because when we're talking about yoga and low back pain, just wanting to make it clear that we're not necessarily suggesting to people that yoga may help, like that they just fell and hurt their back like 2 days ago and that this is necessarily what they should do, but more for that longer lasting.
If there's an obvious mechanism of injury, like if you got, if you had an oh shit moment and hurt yourself, then there's probably some damage and you're just going to need some time to recover that. And the acute versus chronic distinction doesn't even come up for quite a while. But interestingly, a lot of chronic back pain, it was chronic from day one, in the sense that it was never a straightforward injury. It was always complicated, multifactorial. There are probably cases of, so-called acute back pain that we're only calling acute because they're brand new. But in their nature is probably exactly the same as it is 10 months later when you're going, what the hell is going on? There's almost certainly cases of back pain that start weird and continue being weird. Mm-hmm. And it's not until 6 months later that we start saying, oh, it's chronic back pain now. But in terms of its nature, it probably was from the word go. And how do you tell the difference? It's not easy.
That is such a great point. And I guess it makes you even think, like, if you sustain like an obvious injury, even in that moment when most of the pain associated with that injury is probably connected to the tissue damage, even that pain is also still influenced by other factors, like like the context of the injury, the environment you were in, hormones circulating in your system. So it's, like even from the start, I guess even thinking of like pain associated with a recent injury, it also is not necessarily only tissue damage that's involved in that pain.
My 3-word phrase for this is that pain is weird, and it can always be weird. It can be weird even in incredibly straightforward seeming situations, which is not to say that it is always weird. Often it's pretty straightforward. Stub toe, ouch. So a lot of pain is not weird, but it can always be weird. There's always the potential for it to get weird. And particularly when it turns chronic, it almost always has, there's some weirdness going on with it.
Yeah. Well, something that you wrote about in the article that's on my blog was kind of clarifying about low back pain or back pain in general, and the factors that are maybe more and less likely to cause it. And I think the header of this section of the article was something like low back pain is less commonly about structural reasons or biomechanical reasons and more about something from the biopsychosocial realm in general. Could you speak to that a little bit? Like these, like what's the nature of many cases of low back pain?
Sure. The distinction I'm making there is pain being either structural or biological, basically. Mm-hmm. And we human beings, we love to think of things in simple terms. We like simple explanations. And so there's an almost overwhelming cultural trend of characterizing pain in terms of relatively easy to understand causes. Something is broken or degenerated or misaligned, basically very, imagining the human body as a kind of complicated machine, complicated, but a machine. And it's actually way more complicated than a machine. Most pain is, especially as it drags on, affected by a ton of variables that have nothing to do with anything that we can easily intuitively understand. And the simplest example of that is always metabolic factors. The physiological milieu of pain is dizzyingly complicated. All kinds of stuff about immune function, and that you can't explain, you can't understand low back pain without understanding those more complicated factors. It's very clear that a lot of back pain is way more complicated than just structure. Another simple way of understanding that is that you can have two people with exactly the same relatively easy to understand cause of back pain. Let's say a herniated disc, famous cause of low back pain, or is it? Because we know that some people with herniated discs are miserable and in a lot of pain, and some people aren't. What's the difference? The physiological and psychological tides coming in and out, constantly affecting how sensitive we are to the structural problems. And those tides, those complexities can be so powerful that they can completely overwhelm any simple, easy to understand cause of back pain. They can be almost the entire story, so that someone with quite a minor structural problem, that's visible on an MRI, that structural problem gets blamed for all their problems. But that same structural problem in another human being with different physiology would just literally not be a problem at all. There would be no case of back pain. So is the structure the problem, or is it just something that we're too sensitive to, and it's the sensitivity that's the issue? So that's the kind of complexity we're talking about with pain.
Thank you so much for describing that so eloquently, and just giving us like a bigger picture understanding of just like all the many factors and the very complicated factors that can go into the experience or the phenomenon of pain, that are so easy to maybe look at from the outside and just point a finger and want to blame on something like you said, structure, or your alignment, or these other maybe easier to see or easier to point a finger at factors, when it's actually probably mostly a lot more complicated than that.
I think that's so tough for people like to wrap their head around, because they've thought from birth, well, they don't have opinions on back pain at birth, from as long as they can remember it, they've only considered that it was a structural problem. Yes. And when you say that, hey, that's not the whole story, it's just like very hard to wrap your head around. I mean, at least it was for me, and people I talk to who are first hearing about this. It's just a big paradigm shift.
Yeah, in many cases, people aren't even aware that there's anything that they're missing. It's the structural paradigm is so dominant. Many people just figure that's it. That's the whole story, and they aren't even looking for anything more. But there's a lot more, where the structure really is the tip of the iceberg. And I'll hasten to say, it's sometimes structure does matter, of course. It's right, but it is wildly overemphasized in the world of therapy.
That makes so much sense. And I think it's a really great takeaway lesson to highlight, is just because someone may feel what they label as pain in their body does not necessarily mean that that's because there's some sort of physical damage to the structure, or that it's structure, which like is this huge cognitive shift to make. But something that you just said made me think, another thing that I've seen you write about before is that when it comes to something like low back pain, there are some instances of low back pain in which what's causing or what's connected to that pain actually is something that's quite serious, or maybe, I feel like I've seen you use the word sinister before. I might be wrong about that, but there are some cases, or ominous, or something that really needs medical attention, like a serious condition. Could you speak to like what proportion of low back pain is that, and like what are some examples?
Cancers and infections are big ones. There are medical problems that cause back pain you got to watch out for. And, the kind of the number one job for any clinician, no matter what their specialty is to be aware of these red flags, signs that there could be more going on here than just the typical case of back pain. I mean, most doctors, even GPs who know shockingly little about pain and musculoskeletal medicine, they typically do know enough to reassure patients that their back pain will probably get better. And most do. Serious, scary, ominous, sinister causes of low back pain are quite rare. So the vast majority of people that healthcare professionals see who complain of, a new case of back pain, most of them will in fact be fine in 4 to 8 weeks ish. But there's a small percentage. I don't have stats on the tip of my tongue, but it's sub 5%, I would say. There's something a little trickier going on. You could certainly also add, profound spinal risk, with something is happening in the spine that is a real danger to its function. But usually, that you had an accident that caused that. So that doesn't tend to sneak up on people. They had a trauma. But the ones that I think the classic examples of ones that do sneak up on people are infections and tumors. Am I missing one, Travis? Can you think of another one?
Those are the ones that come to mind. I think, like you said, it's that this is a really important job that the medical professions are looking for, and it's also something, like you said. Well, it's very uncommon. If we do find it, then we need to raise this up in importance. But then most of the time, whatever percentage of the time that is, it's, oh, I can reassure you that there's nothing very sinister going on, and like we said, your prognosis is very good. So offering that reassurance, but you have to have the training to identify those red flags.
Yep. Yeah, being aware of the red flags is really important for clinicians and yoga instructors who teach classes about back pain.
Question
I'm really
mark.
glad you pointed that out, Paul.
You got to know that stuff. I looked it up on my own website, of course. Also, abdominal aneurysms, popping your aorta in your abdomen, that often manifests as back pain. Yeah, Travis is like, okay. What? That's another one. And the other one that sneaks up on people is ankylosing spondylitis. It's a kind of advanced, fancy arthritis that is a serious disease. And often the first thing that people know about it is they've got some unexplained back pain. So there's a couple more. But I think most of the scary cases are infections and cancers, I would say. But rare. It's rare. Nobody freak out. It's rare.
Right. Like, don't, after listening to this and then your back hurts tomorrow, like, don't panic.
Yeah.
Exactly.
Yeah, it would be about 100 times more likely to be caused by the fear that I just induced in you than by an actual
So, yes, and we didn't even intend to ask this question like for the point of creating fear in people. It was more in my mind. It's more.
No?
No. I mean, it's good to know that there can, of course, be serious conditions associated with it. But in my mind, like the bigger message is just the actual percentage of back pain that is associated with a serious condition like that is quite small. So, not to just suggest anybody who has back pain doesn't. There's nothing to worry about at all. Like we can't really know that, I guess, unless someone goes and sees a medical professional and has red flags ruled out. But once that's happened, I think it's actually rather reassuring and encouraging to know that whatever the percentage is, 95%-ish, which is a very high percentage of low back pain, is not associated with something serious or sinister. And like you said, I hope is likely to resolve itself within 4 to 8 weeks.
The bark of back pain almost always worse than its bite. That's a rule. You can pretty much assume that it always feels worse than it is.
That's a great take. I want to quote you on that and put that out there. But yeah, so think of someone or assume someone who has low back pain and any red flags have been ruled out. So they're in that 95% side where the bark is much worse than its bite. Oftentimes, people with low back pain go to a clinician, let's say a physical therapist or a physiotherapist. One of the most common ways that pain and low back pain are addressed is through movement and exercise, especially in like a physical therapy setting. Right, Paul? Am I correct in saying that? Yeah. So movement and exercise are a widely prescribed treatment to help with painful symptoms, especially low back pain, right?
Yeah, hugely.
Right. So what is your understanding of what the scientific literature suggests, or what an evidence-based approach would be to the connection between exercise and low back pain? Does actual research show that exercise can help with low back pain, or do we just imagine or think that it can, or maybe anecdotally we've experienced that it does, but is it actually shown in research?
Well, we got a good news, bad news situation here, I would say. This is going to come as a surprise to a lot of your listeners, and I'm just going to drop it here with no further elaboration at this time. But a big thing in the world of therapy in the last 20 years is our growing recognition that nothing that therapists do seems to work very well. What?
That's a big point to drop.
Rather than elaborating on that, I'll move on to, and so exercise. Exercise has become the default replacement. Lots and lots of this in therapy world. Well, since we now know that very little of what we do seems to make much difference, at least we still have exercise. And so there's been a lot of enthusiasm about exercise for all kinds of pain problems, but particularly back pain. Being, back pain is the king of pain problems. It's the most common, nastiest common problem that there is. So it's a good proxy for all the other stuff. But this is true throughout the world of common painful problems, is that therapy treatment, not so very effective, it seems, according to the science. But there's all this lovely therapeutic exercise. The good news is that there's definitely truth in there. Exercise is very well known for being the closest thing we have to a miracle cure for anything. It is unquestionably fantastic for metabolic health, especially over the long term. It's great for helping people sleep, which is great for pain. It's great for mood and confidence, all of which is great for pain, because pain is always a combination, some yin-yangy mix of what's going on in the body and what neurological signaling is happening with the complex, high-level, between your ears experience of pain. And so anything that affects your mood is relevant to pain for that reason. Anything that affects your confidence is relevant to pain for that reason. Because we don't experience pain as these two distinct things of, well, I got the neurology on the one hand and I got my psychology on the other. We don't divide it. We just have our experience.
Right.
And yet half of that experience, or sometimes 80% of that experience, is about how you feel about it, what its implications are in your life. If you've got a pain that completely stops you from doing the career that you love, that is a very different psychological experience than pain that has no practical effect on the way you make a living. I type for a living, so sometimes I get some pretty bad finger pain, and that is a scary pain for me.
Yes.
It's completely. If I get back pain, it's like, oh well, I'm just sitting here. I don't have to do any heavy lifting.
Right.
So that experience is very important, and exercise is great for helping with the experience of pain insofar as you can do it. Insofar as you can get away with it, it tends to be a real confidence booster, and that's very helpful. So, and the other, like the wheelhouse, the great strength of exercise, one of the best things it can do, it's fantastic for fall prevention as you age, and all related things. It's really good for maintaining function over long periods of time. So that's all the good news.
And that ties in too with everything that you mentioned. Well, if your function's better, then you're able to do more things, more confidence, engage in your meaningful activities, maintain independence, mood, blah, blah, blah.
Yeah, there's a big difference between a 75-year-old, who can still do the fun things that they loved for many years, and one who can't. And when those two people get into pain, they have very different experience. So there's a bunch of good news about exercise. In many ways, it is true that it is the best medicine, the closest thing to a miracle cure for all kinds of things that we have. But there's bad news. And the bad news is there's a really potent theme in therapy world that you can fix specific problems with specific exercises. And this is often called, in broad strokes, corrective exercise. And that is basically not a thing at all. You also can go wrong getting strong, despite the saying.
Yeah.
And that is particularly, like, there's a lot of people who have very, I am not anti-strengthening. I'm the opposite. I am pro-strengthening.
Yeah.
But it is definitely not true that you can't go wrong. You can go wrong.
Mm-hmm.
You really can go wrong. And often the wrongness is the most wrong, is the baddest for categories of people we don't even think about, we're barely aware of, basically at-risk subpopulations. And a simple example, which will be highly relevant to yoga, is people with connective tissue disease. And everybody who hears that thinks, okay, well, that's not me, whatever. But here's the thing about connective tissue disease. It's way more common than you think. There's a buttload of genetic variations that cause subtle differences in connective tissue function. And it's a spectrum disease. And so for every blatant case of connective tissue disease, there's 50 that are subtle, relatively speaking. And lots of people don't even know. They've got a hypermobility party trick that they've been doing their whole lives. And they just have absolutely no idea that their aches and pains are actually directly related to that there's a pathology there. And it's mild. It's not a serious pathology. You'd probably be fine your entire life. But it's these people who often struggle with exercise therapy and get injured more easily and that kind of thing. And there are other, there's other subgroups, like a very different kind of classic example is a lot of attempts at therapeutic exercise and corrective exercise run afoul of stress fractures. You got a persistent pain. And it gets a whole bunch of loading thrown at it, but it was a stress fracture all along, an unsuspected, undiagnosed stress fracture. And there's a number of horror stories out there about people with stress fractures. And again, not as rare as you think. And those don't respond well to exercise therapy.
Yeah.
But adding load to a stress fracture, bad idea. So there's a bunch of examples like this of different types of patients and people who, it's not going to go that well for them. The gung ho, let's fix it with a lot of effort approach to therapy. There are a lot of painful situations that you just can't exercise your way out of. And that's another theme with back pain, particularly. There are a number of causes of back pain that are simply not going to respond to any amount of exercise. They're not necessarily going to get worse either. They might, but they're definitely not going to respond. And I think one of the classic examples of that is a neuroma or a cyst. Not scary. It's not one of the sinister ones, but it isn't going to go away just because you do a bunch of sit-ups. In fact, you're probably just going to piss it off over and over and over and over and over again. So there's lots of those, right? Like in the giant list of possible causes of back pain, 90% of which we can't be sure of most of the time. At least probably a third of them, maybe a quarter, something like that, almost certainly not going to respond to exercise. So there's a lot of problems with exercise. And then the worst news of all is that it doesn't appear to be a dramatic improvement over anything else that therapists do. It's so good. It's got so many lovely things going for it that it's almost impossible to be negative about exercise. But in terms of as a therapy for back pain, it works about as well as anything else, which is to say not very well.
That it's really good to have you sharing just like a realistic and science-based perspective on something like exercise for pain, because I feel like as you've suggested, it's definitely like the default approach, I think, for many people, and a lot of assumptions, just like you can't go wrong with exercise. It can help and treat just about any painful condition. So it's really good to learn about how maybe that message could be reined in a little bit And it's, not, I mean, I think rarely are things ever black or white. And I know Travis and I kind of try to emphasize that a lot in the things we talk about in this podcast. And it's got to be the same with exercise and strength training and all of that as well. So thank you for painting that picture. And also thank you for explaining something I think is really important. And this, of course, we'll get into, of course, just so our listeners know, we are going to talk about yoga and exercise, but just in order to get there, we kind of want to lay some foundations of just general exercise, to start. Yeah. But you emphasized, I feel that you emphasized that the way that it seems that exercise can help when it does help appears to be kind of more of these like general, bigger picture ways in which it can work. You listed quite a few of them. Versus like, so exercise can be really helpful. It's like good, but it's not so much that it needs to be so specific, which that's kind of getting more in that realm of like corrective exercise, as you mentioned that term. And right.
I think I find that to be I'm curious to hear more from Paul on that, but it's kind of like a positive thing in my mind. It's like, well, we don't have to be so specific because it doesn't tend to be, we can post hoc fallacy our way to, well, this exercise seemed to help, so this is the reason because we fixed this structural thing. And it's really just more general than that. But I think you don't, like, for clinicians, younger clinicians, they're so worried about, well, am I making the right diagnosis, blah, blah, blah. It's like, well, it doesn't have to be that specific that you've identified a muscle or exact whatever, because the effects are more general.
Yeah. The idea is often threatening to therapists because it challenges the value of their expertise. Specific and corrective exercise is something that a lot of professionals have invested quite heavily in, and so they don't hear, oh, you mean I don't have to do all that? Well, that's great. Wow, fantastic. You mean it doesn't really matter? Woohoo, celebration. Instead, the reaction is more, but I have a gym full of equipment and I spend all day long prescribing corrective exercises, so not so happy about this news. But you're right, there is a good news element in it. It really does mean that almost any exercise that you can tolerate and enjoy is going to be helpful. And it's really, I like to think of it as, it's not a lesser or quote unquote, well, I guess it's simpler, but that doesn't mean that it's lesser. It's just different. It's a different approach to training and exercise therapy. You can spend a lot of time talking with people and coaching them and working with them with real expertise, serious expertise about their function and what they enjoy and how to make exercise work for them and what's a problem and what's not and how they can work around things. And that there's tons of room for skilled and expert coaching that has nothing to do with, well, you've got to activate this muscle with this exercise and you must do it 3 times per day. That you can do away with all of that and still have plenty of good skilled work to do with people.
Which I think is like, so again, like mind-blowing crux of the matter. Like, oh, it does, just because you're like not drawing in as you're doing like this or that, like, oh no, that rep doesn't count. It's like that.
You mean like drawing up your belly or whatever, like
to activate the TVA, because it's the TVA that's not, the activating enough, and that's the root cause of your back problem. It's like, well, maybe we should just find an exercise that you enjoy and that you feel confident in doing on your own outside of the sessions, blah blah blah.
Which is simpler, but not necessarily easy. And I've had long, complicated conversations with people about what kind of exercise and how to do it. The strategizing can get quite complicated.
Right. I love how you make that point too, because I do feel like for many people, when they are confronted with that message that exercise doesn't need to be so specific or quote corrective, it might feel like something's being taken away from them. Like well, what about my expertise then? And it can be, I don't know, a bruise to their ego or something like that. But I love how you emphasize, but there's still so much skill and expertise that can be utilized, but it's just like a different focus. It's not so much about, let's be nitpicky about which muscle did you fire first and which alignment did you use. It's just, it can be, in a sense, it can be more laid back, but still require great skill. And I really love that. I think that applies to the therapy worlds, but also to yoga and the way that I see yoga taught. It's kind of there's a lot of micromanaging, which is a term Travis and I tend to use.
Yeah.
A lot of micromanaging in yoga. Yeah, I'm glad you think so. Yeah.
Paul,
so
would you say this is another example of there might be some instances where some of that stuff does matter, or would you say like, nah?
Good question. Like it never matters.
It is a good question. I don't. I'm gonna think before I answer that one. I'm trying to think of an example of it mattering.
Right.
And I'm failing.
You don't want to say never if there could be an example,
never,
but then can you come up with a specific example?
Think of one. Yeah. I honestly don't know that I've ever thought that a case of back pain was, ultimately about something that could be corrected with a specific exercise.
Wow.
I definitely cannot think of an example off the top of my head.
Yeah.
But yeah, I will refrain from saying never.
And that's a very specific, like, one exercise versus a modality of exercise, which is more what the research, more what the research looks at, and then the conversation about yoga as a modality, which we're going to get into.
Yeah.
So now that we've laid some good groundwork, just about in general, the effects of general exercise on low back pain, maybe we could get a little more specific to yoga. And I know when you wrote this excellent article for my blog and also for your website, you did a thorough scientific literature search and review of like what research suggests about the connection between yoga and low back pain. Could you talk? What does research suggest about how effective yoga specifically as a type of exercise? So we've talked about general, now we're talking about yoga. What does the research suggest about how effective a yoga practice could be for low back pain?
It suggests that there is no active ingredient in yoga that is good for back pain any more than any other kind of exercise. It is just a form of exercise. That is basically the disappointing bottom line. And I know disappointing for a lot of yoga fans, because a lot of people would love to believe that yoga has some special power over back pain. But that is not what the evidence suggests.
Thank you for summarizing that. That makes a lot of sense to me. Could you explain, in case listeners might not know, what do you mean when you say yoga doesn't have an active ingredient? That helps. Just what is that term? What does that term mean?
I mean, I'm using that's an informal term, but it's a great way of understanding, the idea of what is it about an intervention, a treatment, an exercise that would make a difference. And we're used to thinking of active ingredients in the context of drugs and pharmaceutical medications, but we don't usually think about that for manual therapies like massage or spinal adjustment or exercise therapies. But it's a perfectly legitimate question to ask, what is it in yoga that might make a difference? And I think it's a particularly good way to think about yoga, because yoga is complicated. There's a lot going on with yoga.
Yes.
There's a lot of potential active ingredients.
Right.
And that, I think that just that simple fact alone, just the fact that it's obvious that yoga is a very, blended exercise experience with many, many different things that you might be thinking about or emphasizing or going for. Just that complexity allows people to kind of hand wave their way to it. Something in there must be good for back pain. Something. And they're not wrong. Something in there probably is good for back pain, but nothing that is any more good for back pain than any other form of exercise. So, for instance, yoga makes people happy. People like yoga. I like yoga. Yoga is fun. And so are many other forms of exercise for other people. And
Right.
we know that fun and confidence and happiness, improving your mood and improving your sleep, we know that all that stuff is good for pain in a broad, non-miraculous way. It's not like it's going to cure a case of back pain to just be in a better mood because you did a yoga class, but it's relentlessly helpful. It relentlessly pushes things in the right direction if you're enjoying your exercise, whatever it is. But looking for the ingredient that makes a big difference for back pain patients specifically is a wild goose chase that you will never get to the end of. There is one of all the things that are in yoga, of all of the candidate active ingredients, there's one that when you examine people's beliefs, they don't think that yoga is good for back pain because it's got 17 candidate active ingredients. They are thinking of one specific active ingredient. Almost everyone believes that yoga is helpful for back pain because it improves your core strength. That's it.
Thank you for bringing
That's
that
pretty
up.
much the whole game right there. That's the active ingredient that's on the table.
That's a widely
not just yogis, but a lot of the research, because of the thinking that the problem is the core, then they're looking for interventions that target the core. Yoga seems like a good candidate. Yoga may very well be a good candidate for that. And then, like you said, well, that must be the active ingredient. Besides what you already mentioned of the many things that could be, like mindfulness or the social element of doing it with friends or with other people or a teacher that you trust, or the relaxation or the breath work or the expectation that it's going to work. Like all of those things could be some of the 17 reasons, but the one that people think of the most is the core. But as you mentioned, that's not really true.
Yeah. I think there are two. Core strength is by far the leader. And then a distant second, but still way bigger than all the others put together, is flexibility. So people believe that those are the two active ingredients, that yoga will help you with your back pain because it improves core strength and because it makes you more flexible. And the corollary of that is people believe that you have back pain in the first place because you have a weak core and you aren't flexible, especially your hamstrings. Those beliefs are very pervasive. They're often not spelled out. They're often only left implied by the need for core strength or flexibility, but they are often spelled out. I've seen plenty of therapists over the years who tried to treat a case of back pain entirely by convincing their patient that they needed more flexible hamstrings. So those are the two big active ingredients, with core strength way out in the lead, and they are both based on very dubious theories about what makes back pain tick. The reality is that core weakness is not a significant cause of back pain, if at all, and flexibility, tightness, even less so. Even if we generously say to the core strength enthusiasts, a weak core is a cause of some cases of back pain. Even if we grant that, there's still so many other cases of back pain that have nothing to do with that, and virtually no reliable way to distinguish between those. And frankly, I'm being generous giving core weakness any credit for any back pain. The evidence is pretty overwhelming that back pain isn't caused by core weakness. That ain't a thing.
But the funny thing is that a lot of the interventions for low back pain, both clinically and in the research, are core focused, whether it's they call it motor control, or core, it's more of an endurance based thing or a strength based thing. And then the corollary to that as well, they do work a little bit, but about the same as everything else, which is only a little bit.
Right, because it's just you've just found yourself another way to exercise, and exercise has other active ingredients that are a little bit helpful. And this, I mean, this is almost, well, there's a number of reasons why these ideas are persistent, but for sure one of them is that because, yeah, every time anyone does any kind of exercise to, allegedly improve their core strength or their flexibility, they typically do feel a little bit better. Not for the reason they think, but they do feel better. And that really tends to keep the ideas alive and unexamined. We have a casual assumption that, oh yeah, I probably should do more sit-ups and my hamstrings are probably too tight, so I'm going to do that. And then you get a little bit of confirmation, you feel a little better, not for the reasons you think, but you feel a little better. And so the idea that it was weakness, that it was inflexibility, just lives on unchallenged and unexamined.
Oh my gosh. Thank you for pointing out. I totally agree with you that in my experience, both the core and tightness, and specifically tight hamstrings, for some reason, like tight hamstrings gets really highlighted as beliefs that people have about why you have pain or what you need to do in order to fix back pain specifically. And of course, there's so much more that people say, but I agree that those are two of the biggies. But it sounds like what you're suggesting is neither of those approaches, core strengthening. And as Travis mentioned, sometimes people we'll talk about that as more core stability or maybe motor control of the core region, which I guess technically core strength, core stability, and motor control they're not necessarily all like the same thing. But regardless, they don't seem to have an active ingredient, which is that term that you defined for us. And neither does like stretching the hamstrings have like a specific active ingredient that's special to those types of exercises that specifically help with back pain.
Yeah.
Do you think that one of the reasons why, well, you actually stated a couple of great reasons why the myth about the connection between the core and back pain tends to pervade. But do you think another one is just that it's just the core is the region of the low back, so people just think like if I have pain there, it must be specifically about that region, and therefore that's what I need to target?
Yeah, that fits in with the theme of we humans tend to go for the obvious and the simple, and this is really all well expressed by that comic that shows a long lineup of people lining up at a kiosk that says true but wrong. And there's absolutely, oh man, I blew it. What does it say? They're lining up to find out something that is wrong but appealing. I think that's it.
I can envision the comic.
Yeah.
Yeah. And then the other one is true but not appealing. Except the comic has a much better word than that, and I blew it. I can't remember.
I feel like I've seen that comic before. Yeah. No one's at the other line.
Yeah, no one's at the other line. Yeah, depressing complexity is not attractive to people. So that's always the main reason.
Don't go to Paul's website.
Yeah, don't go. Yeah. You called me a brilliant businessman or something earlier, and I laugh because my entire business model is based on trying to convince people to pay money for me to tell them that what they believe is wrong, and that includes professionals who are making a living from those beliefs, and it's insane. So what the hell am I doing? That's literally my business model is, please sign up for my for a membership on my website. Please buy a book so that I can tell you how wrong you are about so many things. It's the worst business plan ever. And by the way, we've started just in the last few minutes to impugn the reputation of stretching along with yoga, which is going to be another mind blower for people. It's this, this whole other thing is like, I'm just kind of dismissing stretching and flexibility. And people are probably starting to wonder, what is wrong with this guy? Is there anything he believes in? No, not really. I'm a cynic about everything. That's what the evidence has taught me to be.
You're a skeptic. Yeah.
You can trust me though. You can always trust a guy with a flower growing out of his head. I got to move that thing. Where were we?
I think you brought up stretching and flexibility, and I'm glad you mentioned that again, because I do think there is this like base level assumption that people who are more mobile, like quote mobile or more flexible, will just naturally be living in bodies that move or function more quote optimally. This is kind of just like that magic beliefs. But there's certainly an assumption that like flexibility, aka mobility, is, if we treat those as synonyms, is important for a pain-free body. And if you have pain, then you need to work on flexibility and mobility. I mean, that's a big trend out there, don't you think?
Yeah. Mm-hmm. Yeah. People believe that flexibility is a pillar of fitness, like strength.
Right.
And it's not. I said it. Yeah, this is a real mind blower for people, and particularly challenging for the yoga audience. Sorry, yoga audience. I repeat, I do like yoga. I also like stretching, by the way, but flexibility.
Thank you for repeating that.
I do. I like quite a few things that I don't think are as medically beneficial or as fitness beneficial as is popularly believed, but I still like them for other reasons.
Great point.
But the mind blower is that flexibility is not, in fact, particularly important for fitness. The very few people need to be flexible, and flexibility doesn't appear to matter much for much of anything. And people always rush to give examples of athletes that need to be flexible to do what they do, and that's true to a point, but even they often need less flexibility than you would think. And then there's the killer fact that stretching isn't necessarily the best way to get to flexibility. That in fact, loading through a range of motion, not stretching, not just pulling on tissue, is what you want if you want flexibility. But most people don't need it, including a bunch of fitness category, a bunch of athletic categories where there's a strong assumption that these athletes need to be flexible, and some of them do, but fewer than you think. So this is all quite radical, but I'll end on a nice note, which is that yoga does tend to load muscles through a range of motion. It is more than just pulling on muscles, and that's nice.
Yeah, thanks.
So to the extent that you want to be flexible, yoga's a pretty good way of doing it. And there's just a limit to how valuable flexibility is for fitness or for back pain.
Yeah, I'm really glad you mentioned that, because there's nothing wrong with working on flexibility or one's mobility. And like we clearly do a lot of that in yoga. But it doesn't need to be that we're doing it because we're trying to prevent or treat pain, or because we're trying to like optimize our body's functioning. Like that, it doesn't seem that those types of reasons are evidence-based, but that doesn't mean it's not worth doing, especially if it's built into a type of movement that you love, like yoga, that gets you up and moving, and it's part of that practice. It can be really beneficial, but just maybe not for some of the reasons that we tend to hear why people just like are like yoga or flexibility is so important for these reasons. Yeah. So I feel like you've done a really great job of kind of presenting for us what you found the scientific literature to suggest about just a general yoga practice and its potential effects on low back pain. So it's kind of general effects of yoga on low back pain. Someone has low back pain, they start taking yoga. What may they expect could be the result of that? So that's kind of one like half of the topic of this yoga and low back pain conversation. And then there's another half, and hopefully I'm describing this in a way, it's a little complicated, but hopefully I'll make this clear. So there's the idea of general yoga class, just generally helping someone who may have some back pain. But then there's the phenomenon in the yoga world where there are specifically yoga classes or yoga books or DVDs or workshops that are called something like, but generally something like yoga for low back pain. Right. So it's more specific. It's like different than just like I'm going to a general hatha class and maybe I feel better after. That's general. But then we're talking specific where the yoga class is titled. This is yoga for low back pain. And I think that's kind of the crux of what like these questions Travis and I have had a long time and we've talked about amongst ourselves. And we're really excited to get to have your your insight is such a pain science authority and a therapeutic world authority. Yeah, I guess this is kind of a general question, but what are your thoughts on these classes, on this type of yoga class that is yoga for low back pain? The implication being they're designed to help treat. I believe that that's the implication, that they're designed to help someone who has back pain feel better. Mm-hmm. What are your thoughts on such class styles?
I think it could be done well. I think it probably isn't done well a lot of the time. I think very often the focus is on alignment and core stability, and flexibility, all of which are clean misses in my mind. Yeah. And I worry a little bit about patients with back pain that is not going to respond well or might even respond badly. I worry about red flags getting missed by yoga instructors who know lots about yoga and a tiny little bit about back pain, and particularly don't know when to tell a student, you probably should be in a doctor's office rather than here. I worry about that. Right. But it definitely can be done well if you teach the class essentially as a, sort of subversively undermining expectations. When people come saying, I think yoga is going to help with my back pain, and you say, well, it's a great way to exercise. But it may or may not help your back pain. You can teach the evidence, and you can teach people to move away from these myths about what will help back pain and what won't. And that's very valuable. And it doesn't have to be comprehensive. It doesn't have to be a back pain class. But rather than reinforcing dubious tropes about back pain, it could do the opposite. It could subversively undermine them while also having a nice, safe exercise class for those patients. Definitely possible to do it right.
That's I think a really important thing to point out, and it's something that I think Jenny and I in our work together sort of pride ourselves on. Hey, maybe a lot of people maybe the paradigm currently is problematic, in this case, where oftentimes these classes, if you go on YouTube and search yoga for low back pain, you're going to get tons of classes. They're mostly going to be focusing on those structural, explanations where you need to do specific postures, specific exercises.
Change your posture or your alignment.
Yeah, definitely focused on the core. And then they're going to sprinkle in all this nocibic language about how fragile you are. And that's the cause of your So like you said, the correct way to do this would be entirely flipping the script. You don't necessarily, it doesn't, yoga for low back pain, just having a general yoga class is going to be as beneficial for low back pain as any other exercise, maybe. And with the caveat that that's not that great, but if you can sprinkle in the education, the anti-education or the de-education on all of those other things that maybe people have heard throughout your yoga for low back pain class, then maybe you actually can have a productive yoga for low back pain. But at the same time, recognizing that many yoga teachers aren't qualified to identify those red flags. In your article on Jenny's website and your website, you pointed out that sometimes people get worse. And the percentage of that people might be, I think the number you quoted was 1 in 12. So if you have 20 or 30 people in your yoga class, some people might do better, but some people might do worse. And that's a tricky thing to navigate. But anyway, the positive spin you could put on it is there is a way to do this well. This is not currently the paradigm that we're operating under, but if you do all these things, and like you said, well, maybe it's almost like the antithesis of a yoga for low back pain class that we're calling yoga for low back pain class, but it's not like this can't be done well. It's like the opposite of what you would expect.
Yeah. I like to make the distinction like this. It's what we want is yoga for back pain patients, not yoga to treat back pain. And
Yes.
this yoga for back pain class is about delivering yoga to people who happen to have some back pain, and that's a thing. We can certainly
Right.
specialize and customize a yoga class
Yeah.
for that patient group. And I would love to see a teacher of such a class who made a point of being educated and informed enough about back pain to be particularly aware of the red flags, and they can just
Yeah.
be part of the extended network of community healthcare. And that patient, that one student, that something smells funny about this case, and that yoga teacher who made a point of learning about the back pain flags learned enough to know to say, I think you should go see a doctor about this. And that could save a life. No, I'm not
Yeah.
kidding. Because cancers do cause some back pains, and there are things to watch out for, and those cancers are often not caught. I'm going to tell a story about, I'm going to forget his name. He's an actor who was doing training, very vigorous training for a role, and developed back pain. And nobody flagged it as a problem because the training was so intense that everybody's assumption was just, well, that's just what happens when you train this intensely.
Right.
It's unfortunate that it's this uncomfortable for you, but you're training so hard.
Like exercise training, you mean?
Yeah,
Like
he
strength
was
training? Okay.
training to to look
Got it.
amazing without many clothes
Oh,
on
got it.
for a gladiator role.
Okay. Yeah.
And he did. He looked very good without many clothes on, and he did successful training. And he was dead a year later because that back pain was caused by cancer. And so, yeah, being aware of the red flags, it's not a joke. Yeah, it's not going to be relevant to many patients. But what I wouldn't give to see every yoga class for back pain in the land have that be the primary educational focus for the instructors. That's their main concern, is let's just do yoga while I notice red flags occasionally. That would take just that one thing would be a huge upgrade across the land. But there's many other ways to upgrade the experience of a yoga for low back pain class. When, very often when massage therapists first start their process of awakening and realizing that much of what they've learned and believed about massage therapy is nonsense. Very often they have a reaction like, well, what am I going to do then? What is even the point? Trust me, there's still a point. You can do a ton of fantastic massage therapy without believing any of the standard myths of the industry. And it's exactly the same for yoga. You can teach a great yoga class to people with back pain. Just don't go in with the expectation that you're going to be fixing people's back pain, because that ain't gonna happen.
Wow. I think that's so well said. And is a really nice way to take somewhat of a positive, or not even somewhat, to take a positive spin on this question. Because I do feel like, at least for me, and maybe for me and Travis, like when these questions have come up for us, it's been more maybe from being a little critical of the idea of like, or just the way that we see yoga for low back pain classes generally manifesting. And I do, at least in my experience, I feel like it's certainly the vast majority of yoga for low back pain classes I would suggest that they're not done in an evidence-based manner. But it's just really nice to hear this hopeful message from you, Paul, because you know the scientific research so well on all of these topics. And you're suggesting that you think yoga for low back pain can be done in an evidence-based way and in a positive way. It's just that's likely that doesn't seem to be the case currently with at least the majority of yoga for low back pain classes. But if people listen to this episode and learn from you, maybe they can update or upgrade, like you said.
Could be an interesting study. Look at the top 50 search results on YouTube and see if the
what
narratives
percentage of them.
Yeah.
I'm pretty sure I know what we'd find. I have a strong idea of what we would find. And I do think, despite all the attempts to be positive about it, being possible, it is problematic in the real world, and
Right.
and a problem that we haven't mentioned is not just the dominant reality of how these classes are actually done. It's just that even advertising yoga for low back pain, just without any reference to the content of the class, it reinforces the idea that people with back pain need core stability and flexibility, because in people's minds that's what yoga is for if you have low back pain. So you just marketing it as a class for back pain patients is a problem right away, and you would have to counteract that. You'd have to actively fight that and say, I know you came because you believe that yoga is good for back pain, but you have to really get on that, because literally everyone who signs up for the class is thinking the existence of this class validates my preconception that yoga is therapeutic for back pain. That is highly problematic.
Yeah, which is an opportunity to get in front of people, but
you got to do it.
The people who don't get in the room and just see it perpetuates it. Unspokenly perpetuates that false narrative.
Yeah. What I'd rather see, and I'd never see this, right? Like maybe a better way to go, because advertising yoga for back pain, it just so neatly plugs into people's biases. What about yoga for pain? Just a yoga class for people who have persistent pain. Maybe a little less likely to confirm people's biases there. A little less.
How do you see that as being different?
It's the for people with distinction, as opposed to yoga to treat. Right? If you just say pain, I mean, probably nobody thinks that yoga is good for all kinds of chronic pain, right? People, as much as we love oversimplifying things, nobody's that naive. We understand that there are lots of kinds of pain that are really difficult to treat and may not be affected by yoga directly. Yoga may not be therapeutic for them. Yet, people with chronic pain of whatever type might enjoy doing yoga and might enjoy doing it in a way that is relatively safe, and there's a little bit of oversight, and they can have some confidence that the instructor will spot red flags and things like that. So maybe that's a way of framing it that's a little less prone to misinterpretation.
Yeah, that makes a lot of sense. Thank you for explaining that, because it certainly seems, I think, like one of the things the world needs less of is nocebo. And I think we could all agree that when a yoga class or a movement class or a physical therapist, like so many different contexts, but when the setting for those contexts is in the paradigm where pain is always structural, kind of these older school ideas, one of the major drawbacks of that is just the beliefs that then get implanted in people's minds or reaffirmed in their minds. And then when we hold these unhelpful beliefs about where our pain comes from, they can serve as nocebos that actually could, because of the psychosocial effects on pain, they could potentially help to perpetuate pain or create pain where there wasn't pain before. Like if a yoga teacher is teaching the class that they need to be in proper alignment or proper posture in order to avoid pain, that can then, maybe plant seeds of ideas in their minds that then they might leave the yoga room with, and then believe that something like that is super important. Which could have unintended effects, at least I believe.
Yeah. Eliminating all nocebic language from yoga classes would be another fantastic upgrade. And for those who might be wondering, we keep saying nocebo, but I don't think we've defined it.
Yes. Thank you.
This is aggravating symptoms through belief, rather than it's the opposite of placebo. Placebo is relief from belief, and nocebo is the opposite. It's grief from belief. And it's a surprisingly strong phenomenon. You can really make people hurt with nocebo. The canonical example is and this is this is a true story, but there are many other true stories like it. The man who pooped blood. There's blood in the toilet, freaked out, agony, 911, gets to the hospital, goes through the process. Doctor figures out he ate beets. was beats. That guy suffered real pain.
Yeah, he did. Yeah.
He had a full-on
literally
pain experience, and that this can happen. One of the most prominent skeptics in the world, Dr. Stephen Novella, my old boss at Science-Based Medicine, he has a great story similar. He peed blood one day, and because he's a doctor and a very good one, a very smart one, he knew that blood in the urine basically doesn't have any happy explanation. There's you see blood in your urine, you in trouble. And he kind of freaked out. He had a proper freak out until he remembered beets. It was the beets again.
It was the beets again.
Another beets story. You can do it if you eat enough beet. I think there's a genetic difference that not everybody does this. It's like asparagus pea. What's with all the pea? If you eat enough beets, your pee will turn red. And that managed to freak out one of the... I mean, Steve is one of the best critical thinkers I know. That man knows more about how your brain can get stuff wrong than anyone else alive that I can think of. He's a neurologist, by the way, as well as a skeptic. And he got fooled by, he got grief from belief. So when we're talking about nocebo in yoga class, what we're talking about is saying anything that perpetuates or reinforces the idea that we are fragile and crooked or vulnerable to back pain. And that belief can actually lead to having pain where you wouldn't otherwise have pain. It's one of the things that can make the difference between, that guy's herniated disc is causing him pain and that lady's herniated disc is not causing her pain. The difference, there are many possible differences, but the difference could literally be that one of them has bought into the idea that they're fragile and that the spine is a delicate structure and the slightest thing goes wrong with it and you're doomed, and the other has not. Right? That could be the difference between those two
or
people.
That they ate beets.
Or that they ate beets, right? Yeah. My disc is herniated and my pee is red. Oh my God. So that we want a yoga class that doesn't reinforce those fears about the spine because they're unjustified. The spine is ridiculously robust, even when injured. It's insanely robust. By quote unquote design, it is a redundant system. It has a whole bunch of very similarly functioning joints, and you can do incredible damage to one of those joints, and the others will, in many people, take over and handle function with remarkable ability. My wife is one of those people. She had a terrible, terrible car accident in 2010 while traveling alone in Asia. Shattered a vertebrae, and had basically no issues with back pain for most of the next 10 years. She does now, I will add, but for years after that horrible injury, is fine. Really no problem with her back. So it's a stupidly robust structure. And all of these nitpicky fears about, oh, you're slightly out of alignment, you poor thing, you're doomed, is, it's terrible. It's a gross misrepresentation of how the system works.
Oh, that's so well said. A gross misrepresentation and also potentially doing harm when we're thinking about nocebo, which you defined so well. Thank you for outlining the definition there and that difference between nocebo and placebo. And I personally find that I think nocebo might be the biggest problem that at least I see in the yoga world in general, and that I try to point out and raise awareness of. I think, just like you said, if that were eliminated from yoga, it would be a huge transformation in general.
Huge win.
Yeah, huge win. Totally. And hopefully work like the work that you do on your website with all of the education that you do and what we try to share through our work together, Travis, like hopefully all of this contributes to some sort of shift in people's understandings and beliefs around the body and pain and how it all works. So
say no to nocebo.
Say no. We should make that a bumper sticker. Another quotable quote. Well, Paul, I feel like you've done a wonderful job answering our questions today and just taking a really thoughtful and thorough look at this important topic, I believe, for the yoga community. Travis, did you have any like last questions to ask, or do you feel like
I
Paul
think
pretty
that
much
we
covered?
nailed it,
I
but
think so too.
we should let the people know where they can find Paul.
That was totally what, yes, absolutely. So Paul, so for sure, everyone can go read your article on my blog, which, like I said, is live. We have the link in the show notes. You can also read an expanded version of the article on Paul's own website in his ebook, The Complete Guide to Low Back Pain. That's what it's called, right, Paul? I think that's
right.
what it's called on here. Yeah.
Yeah.
So
And
we'll
it's
have the
easy to
link to
get
that.
to. There's a link. There'll be a link in the show notes, of course, but you can also just go to
Yes.
painscience.com/LBP for low back pain.
Oh,
And
easy.
that'll take you
Yeah.
there. There's a long free
Great.
introduction to the book, like really long, quite a
I was
substantial
looking at
introduction.
That's kind of your specialty.
Yeah, that's what I do. Yeah. I ambush readers with a paywall after they're already hooked.
That's
So
I meant
like
a
thorough.
very thorough treatment, yes, of
Yes.
topics.
Oh, thorough. Oh, you meant thorough, not the ambush part.
Yeah.
No.
Yeah, no, and I give away an absolute buttload of content. The vast majority of content on
You
the website is
do.
free, but I do have
It's
a few
amazing.
books which I have to sell in order to keep the lights on. So buy
And
a
also,
book,
Paul,
read the free version, and then come and look for the book.
totally. And also people can be members on your website, right? Like
They
for more
can,
content. That's like a different,
yeah.
that's not just the book, that's like a membership to
Yeah,
your
like
what you
an
share.
example is early on we were talking about the you can't go wrong getting strong thing. So I have a big article about strength training, and it delivers pretty much everything that anyone might want to know about it. But I hold back a little fun, quote unquote fun bit about all of the different, a list of the different ways that you can go wrong getting strong, and that's only available to members. So like 90% of the article is free, but there's this interesting extra bit for for people who are particularly keen, and that pattern is repeated across the site. Lots of dorky extras are set
like
aside for
audio
members only.
audio version of your
Yeah,
articles,
audio
don't you do that?
versions.
Yeah.
Yeah.
So I would think it would really pay to be a member on your site. People could learn so much, and they could support you in all of this work that you really like tirelessly do for
and
all
you got to
of
do
us.
is get past that barrier of the fact that I'm going to tell you things you don't really want to hear. So.
Exactly.
Now give me money.
It's just the integrity thing to do. It's like how you understand what the evidence suggests. And so if people need to do some cognitive shifts around that in order to meet you there, it's like their work to do. I feel like all of our work to do.
And the bright side of it is that I know that every single member and customer I have is a particularly amazing and awesome and intellectually mature person. So it's a good club.
That's fantastic. Yay.
Thanks, guys. Appreciate the interview.
Yeah. Thank you so much. Yeah, we feel we're honored to have had you on, and we encourage all of our listeners to go learn from Paul. Clearly, he's so knowledgeable and has so much to share. So thank you, Paul.
Thank you very much.